Hello, everyone. I'm very pleased to have this opportunity to inform you about the possible solution we found for the implementation barriers of the Partner Imbalance Program. My name is Lizzy BOOTS, and I'm a researcher from the Alzheimer Center Limburg and Maastricht University. But first, a little background. Along with the burden commonly experienced by informal caregivers of people with dementia, the lockdowns due to the COVID pandemic have had a great negative impact on the emotional well-being, physical health, and social relationships of caregivers. And several studies have actually shown that the levels of anxiety and stress drastically increased among caregivers, and that 61% of caregivers in the Netherlands find it harder to provide their care and feel more burdened by their caring role. The pandemic has also changed attitudes towards social online support and caused a necessary digital revolution. Benefits of this include the ability to reach more remote areas, improve the care efficiency, reduce costs, and provide alternatives that are safer for vulnerable users and healthcare professionals. And both clients and professionals are increasingly comfortable using these digital solutions. The relevant example in this context is the Partner Imbalance intervention. Partner Imbalance is a digital self-management intervention focused on increasing self-management skills at an early stage to prevent overburdening at a later stage. It combines personal guidance by a professional coach, like a case manager or a psychologist, with thematic modules in an online environment. During COVID, it was one of the tools that dementia healthcare providers like case managers in the Netherlands used to stay in contact with the informal caregivers and to continue to provide the necessary support. Partner Imbalance has been proven effective in improving the self-efficacy of caregivers. The perceived control increased in the intervention group, and also the quality of life of the caregivers of people with dementia. And these factors are related to later admission of the person with dementia in a nursing home. During the COVID lockdowns, Partner Imbalance had a big boost. Professionals were actually forced to use online tools. That's why some of the implementation barriers that they experienced before were lifted. Throughout the Netherlands, we educated 76 new coaches, and hundreds of caregivers use Partner Imbalance. And Partner Imbalance is currently adapted to the UK context within the Care Coach study. Case managers who use Partner Imbalance indicated that they experience a deepening in the relationship with their caregiver. These home visits actually, that they were able to do the home visits later, they were more efficient and sometimes not even necessary due to the contact that they already had with the caregiver throughout the platform. However, the implementation research performed by my colleague Hannah Christie showed that there are several barriers to structurally implement Partner Imbalance. First of all, it takes time, and it asks for adjustments of work routines. And secondly, the reluctance of professionals to offer a program due to the assumptions of internet use of their clients and the burden that they already experience, and that this program might cost them. And also the uncertainty of financing options in the long term and the lack of long-term cost-effectiveness data. To overcome these barriers and avoid losing the momentum of this digital revolution during the COVID pandemic, we formed an innovation cluster in which healthcare providers, healthcare buyers, and the product collaborate to sustainably adopt Partner Imbalance in dementia care at this time, but also when the crisis is over. And with this innovation cluster, we will follow the Consolidated Framework for Implementation Research, or the CIFER of Damschroeder et al. This model describes 5 domains that can influence the intervention implementation, scaling up, and also the assurance. And by forming an innovation cluster, which is also one of the recommendations of this implementation framework, efforts are made in every domain of the CIFER to remove the experienced barriers. Examples of efforts in our current project are performing an SROI analysis, or a social return on investment analysis, to translate societal impact for different stakeholders into actually euros. And also working on increasing the self-efficacy of the professionals delivering the partner imbalance intervention. So it's easier for them to deliver this intervention, and it makes it also more efficient. With this approach, we expect that all case managers in the south part of the Netherlands will be trained as partner imbalance coach within 1 to 2 years and have the confidence to use partner imbalance effectively. And in 3 to 5 years, we aim to include partner imbalance as part of the standard care package option that is provided by case managers, so that all caregivers have the opportunity, if it fits their needs, to use partner imbalance without any financial barriers. Of course, the main motivation for this work is to increase the resilience of this growing group of informal carers, so that they can continue their care for longer with a higher quality of life. We hope to give you some more results next year. On behalf of all the partners in the innovation cluster and the partner imbalance team in Maastricht, I really want to thank you for your attention, and I hope to see you in Bucharest.